What are you finding in terms of those barriers? How much of it is reluctance? How much of it is lack of access?
That is a very important question, Lawrence, because a lot of people on the other side of the aisle want to blame the minority populations and say, well, they simply have hesitancy, and that's why we see the disparities. But I can tell you firsthand from practicing years in the emergency department and as a public health expert in emergencies that the number one driving factor here is systemic inequalities with access to the resources that these community members need. And as a doctor, I'm very privileged to have a very intimate conversations with patients and my constituents while I'm doing the tests or out there in vaccination clinics, and I hear their stories. They don't have internet to make the online appointments at the vaccination centers. They have to work at the high-risk essential jobs, so they don't have hours to spend on the phone waiting for somebody to pick up and give them a chance. And they're very concerned if they get the test, if they're test positive, that they won't be able to go to work. I have a 55-year-old woman who told me that she didn't want the test because she couldn't miss working because she would miss out on the $300 a week that she's relying on to pay to purchase food for her child.
Well, the Latino population in California is 39%, and yet they have 55% of coronavirus cases, 46% of coronavirus deaths. How do you get the vaccine delivery fast enough in this situation?
Well, Lawrence, first you need to prioritize equity, which means that the resources should go to those that are at highest risk. And Hispanics are at high risk, not only because they usually work the high-risk essential jobs, but also there's disparities in the chronic health illness like diabetes, obesity, and asthma, and other cardiopulmonary illnesses that render them more at risk of dying. Furthermore, in underserved areas, they are very at risk of not getting the resources that they need to protect themselves. And many of them who speak primarily Spanish aren't getting the information in the language that they get. So first, you need to prioritize the risk factors that put Hispanics at high risk of getting sick. Second, you have to allocate the resources, the vaccines, into those communities. But then finally, the thing that most people forget is that public health is practiced on the ground by people who administer the vaccine in the arms of other people. And you can send vaccines to a county, but if they're not sending them or directing them to the right places and working with the right people on the ground to administer them to the hardest hit communities, then you're setting yourself up for failure.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.